हफ्ते 2 दफा खून लगता है और दर्द होता है। हम स्कूल भी नहीं जाते, हमारा बहुत दिल करता है। मैं यहाँ पे अकेली रहती हूँ, यहाँ हमारे साथ कोई बच्चा नहीं रहता, हमारे साथ कोई खेलता भी नहीं।
HIV doesn't come alone. It is attached with stigma and discrimination for the person. How traumatic that would be for a parent to find out that both of their children are HIV positive. Carol and her 6-year-old brother Nemia, already suffering from thalassemia, were diagnosed with HIV.
बच्चे हैं दो मेरे, नहमिया और कैरल। इनको ना बचपन से ब्लड लगता था, इसकी वजह से इनके प्लेटलेट बनते नहीं थे इस बीमारी की वजह। बहुत ज़्यादा बीमार थी और समझ नहीं आ रही थी कि मतलब इसको क्यों ये अलामात सारी आ रही हैं।
From 1981 till 2017, there has been a massive scientific development for HIV/AIDS in the field of research, treatment, and early detection. But one thing that hasn't changed over the years is stigma and discrimination associated with HIV-positive people. Stigma and discrimination against HIV-positive people impairs their ability and will to live a life of dignity. This is one of the many other reasons where the treatment and testing coverage is less than 10% of estimated people living with HIV, and even lower for people living with HIV from the key population's 4%, who accounts for an estimated 61% of those infected.
We are, facing the issues on daily basis. We, keep getting the reports of, denial of health services. We keep getting the reports about, social discrimination, about social stigma, about, hampering people from accessing education and other, community services.
HIV/AIDS is still a taboo in Pakistan. Unprotected sex is considered to be the only mode of transmission, but it's not the reality, as HIV infections have other modes of transmission as well. Unfortunately, Nemia and Carol got this infection after a blood transfusion.
HIV पॉजिटिव जो है ना वो पहले बेटी का डायग्नोज हुआ, बाकी मुझे भी नहीं था, मैं भी नेगेटिव था। जो घरवाली हैं मिसेस मेरी, उनका भी नेगेटिव था। शुरू में हम HIV पॉजिटिव इनका पता चला तो हमें तो बिल्कुल ये अलहदा है, जैसे दुनिया से कट के हम रह गए। आइसोलेशन रूम में डाल दिया गया और बाद में इस कमरे में भी कोई नहीं आता था, हत्ता कि ना सफाई वाले वार्ड बॉय आया हैं या डॉक्टर्स हैं वो भी डरते थे, नर्सेज भी, हाथ लगाने से, कनोला लगाने से कि पता नहीं हमें ना ये बीमारी लग जाएगी।
Despite the level of resources invested, vulnerability is high in Pakistan due to lack of awareness. The stigma attached to it. People in Pakistan are not very open to discuss AIDS publicly. This also prevents people from disclosing their HIV-positive status, because that brings discrimination for them from society. The first thing that comes to their mind is, what would people think about them? How would they treat them? Would they blame them for being HIV positive?
गलत कामों से होती है, जैसे कोई उल्टे काम हो लड़कियों लड़कों से, तो उस वजह से ये गंदी बीमारी लगती है।
मेरी नज़र में जिनको एड्स होता है वो बुरे लोग ही होती हैं, इस वजह से ही एड्स होता है।
जो हमारी बेरवि की वजह से या गलत सोसाइटी की वजह से हो जाती है लोगों में।
गलत कामों से होता है और किससे होता है? ये बुरे लोगों को होते हैं।
मैं एड्स वाले बंदे के साथ रहना पसंद नहीं करूँगा।
And these unfavorable attitudes lead to limited access to healthcare facilities. Effective legislation and its rigorous implementation is the need of the time to create enabling environment at federal and provincial level where negative behaviors can be eliminated.
30% of the people living with HIV/AIDS, they know about their status. They know that they are disease. And only 7% of them in Pakistan really approach for getting the treatment, which is very low. We would like 100% of the people who are suffering from HIV/AIDS know that they are diseased and they are suffering, and we want 100% of them to get the treatment. Another issue is really to ensure access to the services. So, establishment of different health facilities by the government and also the training of the staff, ensuring that the people have access to the different types of the services within those centers is another issue that we fully support.
While the number of new HIV infections has declined globally over the past decade, Pakistan remains one of the few regional countries to witness an increasing number of cases. As the HIV epidemic continues to grow among key populations, with an estimated 133,000 people living with the disease in the country. These startling revelations were made in a survey report of HIV/AIDS Integrated Biological and Behavioral Surveillance, launched by the Ministry of National Health Services, Regulation and Coordination.
2016 and 17 IBBS shows us a very close picture of the key population in Pakistan because it was carried out after 6 years. The last one was carried out in 2011. It shows us that we should focus our attention on the trend which is going upward in the sex worker community population, the key population, and also to take more measure for prevention, because if we could not address the prevention, so it is fair that this the trend which are in in some specific key population it is, so it will spread to the general population. So this time, beside other measures, we will be focusing more and more on preventive measures.
The key challenge for HIV/AIDS awareness is lack of sexual and reproductive health education in schools, though the current government is committed to reduce stigma and raise awareness by 2030. To commemorate the World AIDS Day 2017 in Pakistan, UNAIDS, National AIDS Control Programme, WHO, UNICEF, UNFPA, the Ministry of National Health Services, Regulation and Coordination, and Association of People Living with HIV and AIDS have arranged a series of activities and awareness seminars with the academia, healthcare providers, youth, women and children, medical professionals, government officials, politicians and religious leaders.
Pakistan committed that it has to end AIDS by 2030, but it has to achieve 390s by 2030 as well. 390 means what? Testing 90% of the key population need to be tested. Out of those 90% who diagnosed as HIV positive, 90% of those diagnosed positive need to be on treatment. And out of those 90% people, those who are on the treatment, their virus should be suppressed. These are the 390s. We are under 10%. That gives me a sleepless nights. At how to really achieve those 390s in the coming years if all the forces, all the sectors don't join hands together.
My Health, My Right is the global campaign of UNAIDS this year. In Pakistan, the theme is well celebrated. This World AIDS Day 2017 has been jointly commemorated with partners along with UNAIDS, WHO, NACP, UNFPA, and associated people living with HIV and AIDS, is shining the light on the right to health and the challenges people around the world face in exercising their rights. If a person's right to health is compromised, they're often unable to effectively prevent disease and ill health, including HIV, or to gain access to treatment and care. The most marginalized people in society, including sex workers, people who inject drugs, men who have sex with men, people in prisons and migrants, are often the least able to access their right to health.
My rights must be at the first for getting health, getting medicines to be treated with dignity and respect. My right to health means to work and to get the basic things I need in terms of information, prevention, getting testing, or to be never denied about discrimination and stigmatization linked to HIV. My right to health means it is my own business to go and to ask and to keep relevant information. Health people, health stakeholders, those who are working on health must also consider me as a human being, not as a subject.
In order to end AIDS by 2030, We need to fast track zero discrimination. We need support from society, need rights-based programming, social justice, tolerance, trust, openness, dialogue between communities, and family support. Rights of key populations need to be protected, promoted, and fulfilled.
Government of Pakistan commits bold strategy aimed at ending the AIDS epidemic as a public health threat by 2030. Ministry reaffirms its support on the eve of World AIDS Day 2017 to end AIDS by 2030.